For most of modern history, the moment a baby was born, the cord was clamped and cut within seconds. It seemed obvious. It turns out it was wrong, or at least not based on evidence. In those first minutes, something remarkable is happening inside the cord that early cutting interrupts. At birth, a newborn's entire circulation rewires itself, switching from running on a placenta to running on its own lungs in seconds. And whether you cut the cord immediately or wait a minute or two changes how smoothly that switch happens and how much blood and iron the baby keeps. This is one of the biggest shifts in modern newborn care, and the reason your doctor may now wait before cutting. Let's go inside the first minutes of life. To understand why timing matters, you have to know one strange fact. Before birth, a baby doesn't breathe. The lungs are filled with fluid and doing nothing. All oxygen comes from the placenta, which is acting as the baby's lungs. Because the lungs aren't used yet, the baby's circulation takes shortcuts around them. Oxygen-rich blood arrives through the cord, and special openings in the heart and vessels send it where it's needed, skipping the resting lungs. It's completely different plumbing from yours. So, at birth, two things must happen almost at once. The lungs have to take over from the placenta, and those shortcuts have to close. The trigger is the first breath. When the baby breathes in, air rushes into the lungs and pushes out fluid. As the lungs fill with air, the blood vessels inside them, which had been squeezed nearly shut, suddenly relax and open wide. Resistance in the lungs plummets within seconds. Blood floods into the lungs for the first time. Returning blood raises pressure in the left side of the heart, and that pressure presses one shortcut, the foramen ovale, shut. Over the next hours to days, the ductus arteriosus narrows and closes too. The circulation has rerouted, from placenta-powered to lung-powered. It's one of the fastest transformations in human biology. Now, here's why the cord matters. Before that first breath, the baby's heart is filled mainly by blood returning through the umbilical cord. So if the cord is clamped before the baby is breathing, you instantly remove about half the blood returning to the heart, while the lungs aren't yet supplying their share. Cardiac output can drop sharply until breathing begins. In a baby who's slow to breathe, that means low oxygen and low blood flow at the same time. But once the baby is breathing, the lungs have taken over as the main supply, so cutting the cord causes only a small, brief ripple. The crucial question is not just how many seconds, it's has the baby started breathing yet? This is the case for waiting, delayed cord clamping. At birth, a large share of the baby's blood is still in the placenta and cord. If you wait, that blood keeps flowing into the baby in a final transfer called placental transfusion. Roughly a third more blood volume can move into the baby over the first few minutes. And it's not just blood, it's iron. That extra blood carries iron stores worth 1 to 2 months of a baby's needs. In a landmark trial, delayed clamping cut iron deficiency at 4 months from nearly 6% to well under 1%. For a developing brain that depends on iron, that is a meaningful head start. How long is enough? For healthy, full-term babies, 1 to 3 minutes captures most of the benefit. For premature babies, even waiting at least 60 seconds is powerful. It measurably reduces the risk of death. This is not a long wait. It's a minute or two that changes outcomes. A few honest details. In a cesarean birth, transfusion is slower and smaller because the uterine squeeze is reduced, but a 30 to 60 second wait is still worthwhile. Gravity also matters. Keeping the baby at or slightly below the placenta speeds the early transfer. The biology is flexible, not fragile. So if transferring that blood is good, why not speed it up by squeezing the cord by hand? It sounds clever. For premature babies, it turned out to be dangerous. The idea was cord milking, stripping the cord with your fingers to push blood into the baby quickly, in seconds instead of minutes. For babies needing urgent resuscitation, it seemed like the best of both worlds, the blood transfer without the wait. But in premature babies, the results were alarming enough that a major trial was stopped early for safety. In the most premature infants, serious bleeding in the brain jumped from 6% to 22%. Milking the cord was harming the babies it was meant to help. The likely reason is mechanical. A premature baby's brain has extremely fragile blood vessels. Gentle transfusion over a minute or two is fine, but forcing blood in within seconds can send a pressure surge through delicate vessels. Same blood, same goal, but speed turned benefit into harm. So the consensus is clear. For babies born before 32 weeks, cord milking should not replace waiting. The rate of a good thing can matter as much as the thing itself. Slower here is safer. Now, can you wait too long? Could the baby get too much blood? The answer is reassuring, with a small asterisk. Past 3 minutes, bilirubin, which causes jaundice, can rise modestly, and the blood can get slightly thick, a condition called polycythemia. These sound scary, but in well-monitored babies, jaundice rarely crosses the threshold needing treatment, and studies following thick-blooded babies found no developmental harm. One major fear is also unfounded, that waiting increases the mother's bleeding after birth. Large reviews found no increase in maternal hemorrhage with delayed clamping. The common worry that waiting is risky for mom is not supported by the evidence. Let's clear up more myths. Delayed clamping does not mean waiting a really long time. Usually it's 1 to 3 minutes. The cord does not always have to be cut immediately to resuscitate the baby. In many hospitals, babies can now be helped to breathe with the cord still attached, which may be best for a baby who isn't breathing. And a pulsing cord does not mean the baby is still breathing through the placenta. Once the first breath happens, gas exchange has moved to the lungs. The pulsing is blood still transferring, the transfusion in action. So, the real answer is not one rigid rule. The right timing depends on the baby in front of you. Here's where major guidelines now agree. For a healthy, full-term baby who is breathing well, wait at least 1 to 3 minutes before clamping. The benefits, more blood, more iron, a smoother transition, are real, and the risks are minimal. This is recommended by the World Health Organization and major obstetric and pediatric bodies. For a premature baby, wait at least 60 seconds. This reduces the risk of death and is now standard care. But do not substitute cord milking under 32 weeks because of the brain bleed risk. For preemies, gentle waiting is the safe path. And the most physiologically elegant idea is now in clinical use. For a baby who is slow to breathe, instead of rushing to cut the cord and move them away, help them breathe with the cord still attached. That way, the placenta keeps supporting them until the lungs take over. The science suggests this may be the gentlest transition. 2 caveats. Sometimes, immediate clamping is genuinely necessary. Certain emergencies for mother or baby require it, and that is a valid medical call. And there is a trade-off with cord blood banking. Collecting cord blood needs early clamping, so you largely cannot do both. These are conversations to have with your birth team ahead of time. So the takeaway is a principle, not a rigid number. For most births, a short wait lets nature finish a transfer it was always meant to complete. The old reflex to cut immediately was habit, not an evidence-based rule. And the most important factor is not the clock, it is whether the baby has taken that first breath. In the first minutes after birth, an entire circulation rewires itself. The first breath opens the lungs, lung vessels fling open, pressure shifts close fetal shortcuts, and a placenta-powered baby becomes a lung-powered one. And the cord is still delivering a final gift, about 1/3 more blood and months of iron, if we simply wait a minute or two. Clamp before the baby breathes, and you remove its main blood supply too soon. Wait until breathing begins, and the transition stays smooth. The old habit of cutting immediately was not based on evidence. Waiting 1 to 3 minutes for a term baby, at least 60 seconds for a preemie, helps, while squeezing the cord too fast can harm the most fragile babies. Slower, gentler, and guided by that first breath. That's what the science now supports. If you're expecting, discuss this with your birth team ahead of time. What's right for your specific situation?